Well, it's really a pleasure of mine to host a dear friend and colleague, Dr. Aju Mathew, who we have met several times through various conferences when he actually lived in the US and worked in the US before he moved back to India, and he's been there for a while now. He's going to tell us a little bit about this. But for listeners, the reason I invited Aju, aside from his fascinating career and journey, his understanding of the US healthcare system versus outside of the US healthcare system, but more importantly, to give us an update into what has happened with COVID-19 in India over the past 6 weeks since the last time I've aired an episode on this topic. Aju, welcome to Healthcare Unfiltered. Thank you so much for taking time. I know we're taping this episode on the night of June 10th in the US, which is the morning of June 11th in India. And I know it's a little bit early for you, so I appreciate you waking up a little bit early and joining us. Thank you.
Thank you, Chadi. It's always great to talk to you and meet you. And you're always a very cheerful personality, so it's always fun to talk to you.
I try. So Aju, tell listeners about you a little bit. Let's get to know you.
Yeah, well, it was funny when you were saying about my practice in the US and my understanding of the healthcare system of the US, because I was thinking, is there anybody who understands the healthcare system of the US?
If Bishal Giwali is listening, maybe he does a little bit.
I mean, Indian is much simpler. Either you have money or don't have money. But US is so challenging. But anyway, well, my story, I trained in India. I did my medical school in India. And after that, I really wanted to stay back in India and do work here. But it so happened I always had an interest in doing epidemiology master's studies in epidemiology. So while I was doing my post-graduation study, I got a full scholarship to go to Cambridge to do master's in epidemiology. So I requested my university here to give me a year leave. And they basically said, well, we can't do that. You just have to abscond and come back with a health certificate saying you were ill. No, I said, I'm not going to abscond. I'll resign my course and then I'll resign my post and go, because I really wanted to do that. And while I was doing that, a few of my friends said, why did you consider USMLEs? And that's how I thought of the United States. And I read more about the education system, and I was fascinated with the training in the US. So I applied for residency, matched. But all along, I really wanted to come back to India. This was where my heart is. Fortunately, I met my wife, who also had the same interest. She's also a doctor, but she also wanted to come back. So after our training, I worked for a few years while she was undergoing her training. And finally, about 2.5 years ago, we decided to move back. So I've been working in India for 2 years. I'm an oncologist. I'm a trained hematologist as well, but my practice is mainly oncology. So I'm back in my hometown with my parents. So we had two options, either stay in the US or come back home. This is home. We didn't have any other options. So in terms of my work, at home, in my hometown, I don't have any big academic centers. So I've sort of carved out a private practice setup, as well as a practice in a medical college in a rural area. So I have one academic role, sort of part-time, and the other is my full-time private practice in the city.
And Aju, I know India is huge and big. Which part of India are you practicing?
So I practice down south, the tip of India. It's called Kerala. It's the southern part of India. It's a unique state in that our health indices are at a much higher levels compared to rest of India, almost comparable to that of Japan in terms of life expectancy, in terms of infant mortality rate, all the wonderful things that you hear about in the United Nations Sustainable Development Goals. We sort of reached there, but the rest of the India is lagging behind. But if you consider India as a whole, you should think that the south has done much better than the north of India. So I belong to that southern part. We are a very secular land. All ethnicities, all religions exist peacefully. We are highly educated. I mean, literacy level is 100%. Our health standards are higher. So all of that makes us, we call ourselves God's own country. It's our advertising tourism catchphrase. God's own country, and it has reached some far, but I don't think people who live here would say that because of the mosquitoes. We would probably call mosquitoes own country, and we are guests here.
I'll have to say it's really fascinating to me that you were able to go back, and I say that I admire that honestly, because there's a lot of things that are very attractive about living in the US. One of them is certain things that just are very comfortable, where people take for granted, that are not very easy in low middle income countries and in countries that just are not as wealthy as the US. And, as you know, I'm an immigrant as well. I came from, Syria a long time ago. And so I can understand the difficulty into going to and not that India doesn't have a lot of resources, but certainly they don't compare with the US in general, including patients' resources. So it's really, I really admire that, your ability to do that, because I could imagine that you really have to customize your recommendations and practice based on what's available. And you may not be able to do PET scans every time you want to do a PET scan. And you actually do have to use your stethoscope versus doing an echocardiogram. You know what I mean?
Yeah, absolutely. Cost is always part of our discussion, part of the thought process. We talk about shared decision making all the time, but that shared decision making doesn't work in a place like India. I mean, it can work, but for the most part, as a doctor, I do take immense responsibility in taking a decision for the patient. So I always tell my students that a doctor in India really have to learn wallet biopsy as well. You have to get a biopsy of their purse and see how much money is there, or in some way or the other. You got to look at how they dress, you got to look at where they live, get conversations on how is their income level, what kind of job they have, do they have insurance, and then get a sense of what you need to do. I'll just give you an example. A patient with myeloma who came to see me, an elderly lady. uh, Her M band is high. So should I do a bone marrow biopsy? Hypercalcemia, the clinical diagnosis there. Should I do a bone marrow biopsy? Should I do a PET scan? I omitted all of that. So it's straight to the treatment.
Yeah.
Pancreatic adenocarcinoma. I mean, it's not pancreatic adenocarcinoma until it's proven, but pancreas mass, CA1, CA99 is 8,000, multiple liver mets, 4 good biopsy.
Yeah.
You understand? It can never happen. So a lot of clinical medicine can happen here. Unlike in the US, where you really have to do a lot of stuff to really, really go by the books. So it's a little fun. In terms of the challenge coming back, a lot of doctors call me. So I get a call once a month from someone based in the US to hear from me and my experience here. The major drawback is I've lost my career in terms of my academic career. So if you really need to be on an academic level and publish, I think the US provides a lot of incentives for that. It's a meritocracy. So if you publish, you climb up the ladder. Here, that's not an index at all. So academic career is one that I was willing to sacrifice. So if people are willing to sacrifice their academic career, I think India is a good option. Money, as a doctor, I make decent money for the living standards here. I have no regrets. I don't think any oncologist will regret the money they make here. So that's less of an issue. Quality of life, clean air, outdoors. That's something we miss. I could just walk out 5 minutes and I would just get into a wooded area and just go for a walk in its wood. That's impossible, at least where I live, in a city. So traffic is a challenge, but there are a lot of perks, some disadvantages. But if you weigh the things that you value and make a decision, I think make a careful decision. If there are listeners who are keen to try to return back home, and it's an adventure. No, one day is not the same as the previous day, but it's fun. One tiny example. Coming back here, I mean, our chemo unit, there was nothing. So I had to learn how to give chemo, as in, how much ml fluid I need to use, what kind of fluid I need to use, what kind of infusion set I need to use, what is the kind of needle used to access a port, what is the kind of needle, what is the kind of materials you need to dress up a PICC line. a lot of these minor things. In the US, it's so easy to check box, they click all those check boxes.
Yeah, it's
So that
amazing.
was fun.
It's amazing, and I think what you highlight is the concept of trade-offs, right? I mean,
Yeah, trade-offs.
you obviously, you know, you chose a career path that you said, I'm gonna compromise growing through the academic ladder, but what I'm gaining in return is family and other aspects, and I cannot tell you how much I admire this, truly, and I hope that people who are listening, they really appreciate the things that you're doing. The concept of trade-off. There is no perfect scenario, but often people want to do that. But Aju, I want to talk to you a little bit about COVID-19 in India, and as fascinating as your career is, and I'll get back to that in a little bit. I feel it deserves honestly just one episode. Because you still publish despite all of this. I read a paper for you last year. I think it was in the Journal of Global Oncology, and I know that that part in you still is there, and you're able to nourish it. But COVID-19 in India, in the US, we hear a lot of things. I taped one episode on that about 6 weeks ago. I interviewed a couple of physicians, and I want to try to take listeners through what has happened over the past 6 weeks. But to level set, um, what actually happened in the start from your perspective? Because I honestly feel as if like I woke up one morning and it's all hell in India. Everything was fine, and people were talking in the fall and even in the early winter how wonderful things in India are, and there are no issues, and it's herd immunity, it's cross reactivity, all of these things, all of these theories. And then I woke up one day and it's, my goodness, it's hundreds of thousands of things. So take us back there. Like, what actually happened? And was that surprising to you, or were you really expecting it as a physician?
Uh, I'll take you back to December of 2020. In December of 2020, December, January, that time, the Indian government did zero survey, zero prevalence study, looking at antibodies in a uh, random population. And they figured that 1 in 4 in India were exposed to coronavirus. So 25%. So I think most of us who tracked the virus knew that things were going to get bad again. But I think the magnitude of the wave, or rather the tsunami, as I like to call, as most people are calling it now, or the firestorm, was mind-boggling. The way the virus exponentially grew every day was just mind-boggling. I think moving from December, January to April, when the tsunami actually came into the peak, there was a lot of missteps, a lot of miscalculations. I think I would put our government on the dock, really. There was really a lot of missteps from their part. They assumed, or they were advised probably, that a bunch of our patients or population, we had reached nearly herd immunity and things would go fine, because the signals that were coming from the top of our national leadership were that everything is fine. They were moving about, they were organizing rallies, political rallies, religious festivals, just like nothing had happened. And there was a false sense of invincibility as well. The news reports, I know there were news reports from eminent authors in the US as well, in big media, saying India, there's one country that has evaded corona very successfully, let's learn from them. There was a lot of hypothesis that was branded about our cross reactivity with other infections, our unhygienic atmosphere makes us more immune, and the fact that we had BCG vaccination probably had the hot and humid atmosphere. Sort of all sorts of things that were branded about. But the virus had the last laugh. And the tsunami just came about so fast. But this is how it behaves. We were warned this for the last 1 year, how the virus behaves. We had seen this in Italy, but we were very behind in learning from the experience of New York City and Italy. We never there was that, I think that false sense of invincibility also added on to the problem. Uh, Delhi, Mumbai were badly affected. Where I belong, Kerala was less affected. Just the same reason why New York City and Italy were affected first, because most of the travelers ended up in these places, and the virus moves from urban to rural areas. I'm more in a semi-urban state than compared to Delhi and Mumbai. So we had time to prepare. So we were fortunate in that perspective. But Delhi and Mumbai were overwhelmed. Delhi, for instance, was really overwhelmed.
So then things started happening in April, like you said, the peak. Um, as somebody who lived there, um, I don't know, any reflection, and I don't want to put words in your mouth, but any reflection on the world's response to the
Yeah.
crisis in India? I don't know. I mean, my opinion is I think we could have
No,
done better, but maybe not. I don't know.
I'm always first to blame myself or our own nation, our own national government. I'd like to think that we have to really be self-critical of ourselves first before we blame the rest of the world. I'll come to the rest of the world in a minute, but before that, I really want to put my own administration in the dock again. We have launched satellites to the space. We launch it like cakewalk now. It's so easy now. We have immense defense capacity to mount challenges from both sides of the border. We are a nation of technical prowess. We are a nation of billionaires. If you look at the number of billionaires, we probably rank in the top 10 in the world. So we are not a very poor country as we would like to um, claim ourselves. We are not poor, but we have resources. It's just that resource mobilization is not up to the mark. The brains that use the resources are not up to the mark. So, lack of oxygen, the world saw it. Why did that happen? We were less prepared. We were warned for a year. Hospitals were less prepared. Kerala, for instance, where I belong, our leadership was very careful about all of this. Most of our hospitals developed oxygen tanks, oxygen production plants on its own. We used the funds and used them well. We created the infrastructure well. A lot of the state administration, as well as the central government, the federal government, actually dropped the ball there. So a lot of the blame goes to our own government, our own public, but of course, some part of it should go to the rest of the world. Here's where rest of the world actually dropped the ball. I think it is in the sense of vaccine uh, hesitancy that fueled a little bit of vaccine hesitancy in India as well. The kind of literature and the kind of conspiracy theory that comes out of the US. I just saw some video from Ohio of a woman talking about some magnetic force in her forks and spoons getting. You know, this is a globalized world. Things just travel here so quickly, and very few people in India got vaccines when they could. But by the time the tsunami came, there were less vaccines available. So the vaccine hesitancy is a concern, and that usually always comes out from the West. The impetus for the vaccine hesitancy, we all know about the MMR autism saga. So all of this comes from the West. So our scientific administration and our political leadership in the West have to be really careful. And that's where I think the previous president did a lot of damage to the global health community by fueling a lot of the vaccine hesitancy, fueling a lot of science mistrust, President Trump. And I'm glad the new administration is more scientifically thinking and more inclined to listen to the feedback from doctors and professionals. One thing I always like to say is no country is an island, although we would like to claim so. No man is an island. Someone said no one is safe until we are all safe. So just because US has a lot of vaccines doesn't mean that US is protected from future waves of the pandemic. Because vast swaths of people are unvaccinated, the virus has a lot of potential to mutate into variants of high concern, variants that can evade the immunity, variants that can cause more severe disease. So the appropriate measure for the rest of the world to do is now to disperse vaccines that are in excess capacity. And I believe President Biden declared something yesterday that they're going to release a lot of the vaccines for Africa and
Yeah, but
low and middle
it's
income
been,
countries.
I mean, yesterday is still a day too late, a week too late, a month too late. I guess
Yeah,
over the past month or month and a half, uh, um, Aju, what's the status of the vaccination in India? That's number one. And number two, what's the status of treatment in terms of available therapy, including simple plain old oxygen, right? I mean, I think just a simple oxygen tank. So what's going on right now over the past month? A, do you guys have vaccines? B, do you have oxygen? Do you have steroids? Do you have remdesivir? What's the status?
yeah. Before I get to your question, I just want to add one part. The response of the global community, the people of the world, was tremendous. Was
Absolutely.
really sobering. And I mean, my university, I suddenly saw on my social media page that my previous university was hosting a fundraiser to send oxygen concentrators. I mean, individuals, people were calling, asking, what can we do? And the people of the world reaffirm the humanity that is in existence. The governments may fail, may lack in their appropriate response, but the people, there is still a lot of humanity left in a lot of us.
That
I'm
I
not saying
agree.
all of us.
I agree. No, but I agree with you. I think, like I said, I mean, I really, a lot of people, including myself, have felt strongly about what's going on, and that's really where my disappointment in many governments stems from. Because it's for me, it was, when the U.S. had 60 or 70 million AstraZeneca vaccine shots, you send those, right? I mean, you don't really, where if you're not going to use them in the U.S., you send them to India, to Brazil, to the Middle East. But anyway, I think we could debate this. I'm
Yeah,
obviously clearly disappointed in what has happened. But what's current state in India right
yeah.
now?
So
Because it's been about like close to 6 weeks since that tsunami, if you will.
yeah, so the peak is over, um, and several parts of India, the urban part, Delhi and Mumbai, they have really made it for now. Kerala is still, because we control the virus reasonably well, we're still plateauing. We never had a peak. We're plateauing. Uh, so I think we have crossed that the bad PR moment for India. The situation where people died without oxygen, they in a stretcher, outside hospitals. I think we have gone past that phase, and the government has now stepped up. Most hospitals, most regions in India have the infrastructure, have oxygen and sufficient resources currently. In terms of vaccine, we don't have enough vaccine even now. Every day I hear stories or get calls from people asking where can I get vaccine. I've been trying left and right on all sorts of platforms trying to get vaccine. So vaccine shortage is still there. In terms of vaccine acceptance, about 10 to 12% of Indians have got at least one dose. I think comparable data for the US is around 40%. Around 3 to 4% of Indians have got two doses or for sort of fully vaccinated. The comparable number for the US is, I think, 50% or something like that.
Yeah,
40,
but
50%.
the population of India is 1.4, 1.5 billion. I mean, it's just like,
Yeah, yeah.
it's the,
Yeah, it's a so that, again that therein lies some other problems as well. Again, our government. I put my government in the dock again. We have just three vaccines that are approved for use here. I mean, two plus one just recently. The two are the AstraZeneca one that you always talk about everywhere. The Covaxin, which is an India developed, Indian Council for Medical Research collaborated developed killed vaccine. And the third one that was just approved is the Sputnik from the US, from the Russia. Pfizer and Moderna are not approved yet, despite having data from across the world. The government is sort of holding back for unknown reasons. Well, they know best. I think there's a lot of argument about indemnity. What happens when there's some uh, adverse effects? Is the company at fault? Will they have to compensate? that kind of issues. But the application has been in front of the Indian government for the last 6 months. So they granted the EUA the approval, the quick approval process. They have fast tracked it just a month ago while the tsunami was at its peak. So we don't have enough vaccines, although the rest of the world has sufficient, at least the Western countries. And part of it is because our nation hasn't approved enough. Now,
do you know why they're not approving the Pfizer and the Moderna vaccines?
The Economist magazine profiled the response of some major countries, and it's an interesting pattern. Where there is a strongman, where there is a nationalistic government, the response has been very poor to the pandemic. And Brazil is an example. US under President Trump is an example. And India under Prime Minister Modi is an example. There's a lot of vaccine nationalism. About
what does that
June
mean,
of last year.
What does that mean, vaccine nationalism?
I'll tell you in just a moment. In June of last year, Prime Minister Modi said in August 15th that we're going to launch our first vaccines. But the first vaccines hadn't actually started clinical trials then. So there was a lot of gung-ho statements saying, we are going to be the first to develop vaccine. We are going to be the first to bring out vaccines. We are going to send vaccines to the rest of the world. We're going to save the world, kind of big statements, which was not matched by the reality on the ground. So the vaccine nationalism is exemplified by saying we are self-reliant. We got our own vaccine. And that's why only 2 vaccines were approved for use until the tsunami happened. That is the India-developed AstraZeneca one, which is developed in India by a company called Serum Institute, although the technology transfer happened from AstraZeneca in Oxford. The other is an indigenously developed vaccine called Covaxin. Clinical trial data for that vaccine is not yet out, but the vaccine has been used in Indians for some time now. It's a killed vaccine, but I think it's safe. So by holding up against the Chinese vaccines, the Russian vaccine, the US vaccine, the German vaccine, we are saying, we are self-reliant. So that is vaccine nationalism in one statement.
I see. So, just a couple of points on the vaccines. Is it, when you say about 1%, 2%, 4% of the population, is it a supply issue? Is it the fact that there's not enough supply to vaccinate more people? Or is it that people in India are just more hesitant about getting the vaccines, or a combination of both?
Yeah. So there are far more people in India than the rest of the world can imagine. So vaccine hesitancy is a challenge for a small subset of our patients or population. Overwhelmingly, our problem is one of supply. It is interesting if you superimpose the graphs for COVID cases per day to number of vaccines per day, it goes diametrically opposite. So while the COVID tsunami was raging and the line was actually going right up in an exponential way, the proportion of people that were getting vaccinated was going steadily in a downslope. That's because we just don't have enough supply. We still don't have enough supplies. And that is where I think President Biden and the global leaders need to come together and contribute.
Absolutely.
Now, there is a disaster looming in front of us, and I'm seeing it right in front of my eyes. That's Africa. If you look at some of the graphs from some of the African countries, it's scary. It's India to the double or triple happening now.
That's you're right. That is really a big deal, and that's why I felt strongly against. I thought, instead of vaccinating the children in the U.S., you should vaccinate the adults in low middle income countries. But so, and Aju, in terms of treatment, right now there is PPEs, there is oxygen, remdesivir, like the essentials needed to take care of patients are available, as well as hospital beds. If somebody is sick, they can go to the hospital, they can find a bed.
Yeah, right now we have gone past that peak, so we have sufficient infrastructure. In fact, the government have also stepped up. Infrastructure is good now. In terms of treatment, we have all sorts of bad treatment here, all sorts of anti-scientific treatment. You've probably heard about all these indigenously developed medications consisting of turmeric and ginger and honey and mysterious ingredient
We
that
do them here
fights.
too, Aju. We do them here too. Don't worry.
Yeah, the problem is here it gets the backing of the government. The people who come out with these medicines, some of these are multi-million-dollar industry here, and the medicines are launched by the health minister of the country, and that gives it a lot of stamp of approval. So bad science flows in our veins with the official stamp of approval of our government. Because of that, we have all sorts of treatment options. Ivermectin, there's a big ivermectin cult here. Uh, Probably started in the US though.
Yeah, yeah.
You know, yeah. So we have all the stuff. Recently, we have the Trump cocktail as well, the antibody cocktail, the Cami, the Imdevisanib or whatever that's called, the Camicivir.
So how about this mucormycosis, Aju? We keep hearing about mucormycosis, and there were lots of articles, and I believe you actually tweeted an article that Nikita wrote about mucormycosis, and what's going on there? What's happening?
Yeah, yeah. It's an unbelievably disastrous epidemic of mucormycosis. Who would have thought we would have a pandemic, a tsunami, a firestorm, and then yet another major issue. So to bring your audience into to update your audience, we have seen around 30,000 cases of mucormycosis in India. That is based on official count. The state of Kerala has witnessed around 60 cases of mucormycosis. We manage healthcare better. That's probably one reason we have less numbers of mucormycosis. But the north of India have been struck by this epidemic of this fungus called mucor. It is a locally invasive disease. I'm not an expert for the disease. I have not seen a single case in the last decade. Even now, I have not seen one. But I believe most of the doctors working in the north, at least the ENT doctors, are seeing them. In fact, I just heard from my wife that our hospital had one case yesterday, and our ENT surgeon operated on a case yesterday. So why is that happening? Nobody knows. And that's a shame. And that's a shame because we have 28,000, 30,000 cases. It's easy to do a study, but we still don't know why it happened. It's easy to do a case control study, but we don't know. There's a lot of hypotheses. One is the indiscriminate use of steroids. Because steroids was found to be a proven therapy to save lives in COVID patients, a lot of quacks, a lot of pharmacies started using it from day one of patients having COVID as a prophylactic medicine. And that's bad. Because using steroids while the virus is in full-blown replication phase, the viremia phase, is not good. Because that's going to just accelerate the viremia and cause more damage. And steroids as also causes hyperglycemia or high levels of sugars, which when goes uncontrolled, lowers the immunity and puts your body at risk for getting infections. So people generally think it's a combination of steroids, indiscriminate use of steroids, and the uncontrolled blood sugar levels that is causing it. But some studies coming from the north of India are showing that about 30% of patients with mucormycosis did not get steroids or did not have uncontrolled blood sugars. That brings a lot of questions into what is happening. Is this corona itself actually having some interplay with the fungus? Or, India is known for indiscriminate use of antibiotics too. Is the indiscriminate use of antibiotics altering the microbiome in a person who's struck by corona, and is that leading to a commensal organism like mucor, invading into the person? A lot of unknowns, but I think in the next 1 month or so we will have some studies that explain.
But are we seeing fewer cases now than like a couple of weeks ago, 3 weeks ago or so, or we don't know?
I wish I knew that. I wish our government knew that. I don't think anybody has the data because mucormycosis was notified as a notifiable disease only about 2 weeks ago. So the numbers are just coming in. I don't think we are past the peak of the mucormycosis epidemic. I think we're going to see a little bit more of that.
Got it. Okay, so things seems to be.
What a crazy disease, huh?
It's crazy. It's just crazy. I mean, it's like, you finish from one thing, you get another thing. I was.
I just had something, Shadi. Just a few minutes ago, I got a call from my nurse, and she said her brother, who had COVID a month and a half ago, suddenly experienced chest discomfort overnight, sweating, um, and looked very sick and ill. So he was rushed to our hospital. He's in the ICU, probably myocarditis or probably coronary thrombus. Um,
It's
so
crazy. I mean, it's
crazy.
crazy. It's really crazy disease. And but listening to you, Aju, I feel I think we're turning the corner in India. It seems things are getting better. The hope is that this sustains. I think if between herd immunity that happen from infections and hopefully there are vaccinations that hopefully increase, I'm hoping that we're turning the corner. Are there any mandates in India right now in mid-June 2021 about masks, social gathering? Are businesses open, economy open? What's going on there?
So right now in my state, we are still in a lockdown, a sort of pseudo lockdown, semi lockdown. Most of our government offices are closed. The schools are closed for the last 1.5 years. The colleges are closed. Most of the businesses that are of not urgent business establishments are closed by government decreed. Rest of India, a lot of the places lockdown have been lifted. We are not there yet because our test positivity rate is still about 10%. That's why our lockdown is still in place. And I think lockdown does have some value when a virus like corona is raging around us. I have believed in not instituting lockdown because I thought of the economy taking a bad hit. I think there are better ways you can control corona: wearing mask, hand hygiene, social distancing. But at the peak of an epidemic or a pandemic, I believe there is no other option. When a healthcare system is overwhelmed, there's no other option but to institute a lockdown. And that's where real-time data is very important. Real-time data modeling, accurate statistical modeling is so important for our decision makers to know when to actually put the lockdown, when to actually put the brakes, because putting the brakes soon would just devastate the economy. Putting the brakes late would just kill more people. It's a tough choice for the government.
Is the airport open?
Airport functions, yeah, airport is functioning in most part of India. But our travelers from a lot of countries are prohibited from coming to India, or rather, it's the other way around. We are prohibited to going from to other parts of the world at the moment. For instance, my friend who's come from the US, they can't come back to the US directly. They have to go to a third country, stay there for 2 weeks, and then come back and get into the US, like go to Mexico and then go to US from there, unless you are a citizen of US or a permanent resident. They hold a visa,
Yeah.
so they are looking for an exception from the immigration department to land directly. Um,
Well, Aju, thank you. This was very enlightening into what's actually happening in India. Are there any other things that I should have asked you about the current situation in India? What's going on that you want to share with listeners that I may have just not asked you? I think I have a good vision into what's going on. I'm happy to hear what you mentioned. It's way better than the interview I did 6 weeks ago, where things were really significantly worse. But any other items you would like to elaborate on that I may have missed?
Yeah, I think most of your audience is based in the US. So there's one message, I put in my social media profile in Facebook yesterday to my friends in the US, which is the graph that Professor Topol put in his social media feed yesterday, showing how the cases in the US, more Delta variant, the one that originated in India, are rising. Now, the Delta variant is remarkable because it has the potential to escape some degree of immunity. It is more transmissible, and it actually is reported to cause more severe disease. So 50% of the US is not vaccinated. And I believe hesitancy is a major problem there. So if you have a loved one who's not vaccinated, I think I would strongly urge you to consider it, because Delta is not easy. And herd immunity is less of a scientifically credible way out of a pandemic than vaccination. So get that vaccine rate in the US to close to 80%, 50 to 80. So I think the hesitancy needs to now go out.
Yeah, I think there's less hesitancy amongst adults. I think there is some hesitancy for children, and I believe it's appropriate. I think there is some data in kids right now coming, some reports about myocarditis from the vaccine. There are several reports, and even the CDC right now in the US is investigating that. But amongst adults, I believe that we are going to continue to see increased rate of vaccination, hopefully. But as you said, Aju, this is a global disease, and my sense is that we need to make sure, like from Africa to South America to the Middle East to India and other locations, we need to think globally into how we make sure vaccinations disseminate to get rid of this disease. Otherwise, it's going to come back and haunt us despite vaccination if the variants don't respond to vaccines. Who knows?
It's a challenge. It's a lot of us have become COVIDologists, right?
I
That
know
has
it. Tell
become a
me about
specialty on its
it.
own.
Tell me about it.
Yeah.
We have so many experts in COVID right now. It's crazy. Well, look, this was really such a pleasure to have you on. I really appreciate you just coming on early in India before you head to work. I want to have you one more time, and when things settle down, just talking about the entire career path. I think it's amazing. You mentioned that you get calls, once a month or twice a month from folks who are thinking about going back, and they want to learn from you. So clearly, you're not alone in the thought process, but you were brave enough to actually go back and say, I'm gonna really make it happen. And there are others who are thinking alike. So I really think there's a lot to talk about there that will be helpful to many listeners who are considering going back to India.
Yes, once or twice, once a month or at least twice, once in 2 months, I get a call and I have to spend an hour on a video call or an audio call. Just the most recent one was this Sunday from a Palm Critical Care Fellow in the US in one of the prestigious institutions.
We need to listen. I think I have a business proposition for you. We do like consulting, consulting company. We charge them. Aha. See, I'm starting.
It's a good idea. It's a good idea. But you asked me about publications and publishing. I still write. I still work on research manuscripts, and the only incentive for me to do that now is students. There's a lot of students who approach me for papers, for manuscripts, for work, for research idea, only because they want to go to the US to do residency. So as much as there is interest from people from the US who may want to move back, but it's a difficult challenge. There is multiple fold people who really want to come to the US and get trained in residency. And I'm very fortunate I trained in the US. The training in the US has given me multiple advantages. I know how to manage patients better. One thing, I may not know Harrison's textbook of medicine well,
you don't need
as compared to a lot of my colleagues, in India. The US training is amazing. It focuses on
very practical,
teaching you how to manage. Yeah, I'm good at that.
Very practical.
Although I may not know the Krebs cycle, I'm good at that.
My last question to you, and then I'll let you go, is you have a degree in epidemiology. And obviously, COVID-19 have been a big pandemic and global pandemic. When you wear your epidemiology hat, have you thought about doing certain research studies on the epidemiology front in India, for example, where you are, just to try to address or resolve some of the questions just as an epidemiologist in training?
Yeah, so I'll give you an example. Yes, I just did a study looking at the proportion of healthcare workers who got breakthrough infection when the tsunami was raging in Delhi. And I found that the breakthrough infection rate is very less. And I followed it up later and checked while the tsunami was past its peak and the breakthrough infections were rising. So even before the biological studies have come out in from England and from rest of the world that the Delta variant is causing some breakthrough infection. I could get some insights into the fact that the Delta variant is, as it's rising in a community, the number of breakthrough infections is also rising. But I want to add that I am a useless doctor here unless and until I'm part of a government setup. That's how unfortunately things work here. You have to be part of the government setup for the policymakers to listen to you, for things to work. We're still a little primitive in that way, whereas in the US, you can be part of an institution, you can be part of a collaboration and produce good data, and there will be people who may at least consider your thoughts and ideas. Here, we're still a lot of red tapeism. So as a society, we are still on a path to progress.
Aju, good luck to you. It's always wonderful to catch up with you. Thank God for Zoom, and thank God for the internet that allows us to connect with each other thousands of miles apart. And I hope to see you soon in the US. Maybe you'll come back next year at ASCO to visit or to other conferences. I really look forward to catching up with you.
Chadi, thank you. I want to actually thank you especially for caring for us. At least the intention of having two shows trying to understand what is happening in India is so much caring, and it opens my heart that people in the US, people like you exist, that you care for us. It's a sign of love in real measure. Okay?
I just wish we could do more. Really, I mean, I think I wish we could do more. I think that's where it's very frustrating that the vaccines do exist here and people are not willing to take them while other people are dying elsewhere that they are wishing to get a vaccine. It's just, what can we do? But hey, we take what we can and we hope to move forward. I hope next time I see you, everything will be history for us, my friend.
Yes, I do so too. Take care. Thank you, Chadi.